A very good afternoon to the honorable panel of committee, lecturers and fellow friends. First and foremost, I would like to thank you all for taking the time today to listen to my research presentation. My name is Clarisse and today I will be presenting my research entitled Medical Adherence Among Adolescent Psychiatric Patients, a Multicentre Study. I would like to begin my presentation today by emphasizing that adolescent mental health is seen as a crucial aspect in shaping progressive and competent young Malaysians. Hence, in line with Malaysia's 11th Plan and 2030 Shared Prosperity Vision, measures to improve mental health well-being among adolescents should be prioritized. However, according to the latest National Health and Mobility Survey 2017, the prevalence of mental health deterioration among psychiatric adolescents has increased significantly over the past decade, especially since the onset of the COVID-19 crisis. The pandemic has had a severe impact on the mental health and well-being of people around the world. The implementation of lockdown or MCO, the Movement Control Order, due to the pandemic continues to impede access to mental health services, resulting in high psychiatric treatment dropout rates. The high adolescent psychiatric patients' medication or treatment dropout rate is constantly seen as a main challenge in reducing the severity of psychiatric disorders and treating mental health issues. Therefore, this study seeks to investigate whether medical adherence do have an influence on adolescent psychiatric patients' mental health in Malaysia. Over the span of 6 months, we have conducted this research by using the quantitative method. This is a cross-sectional research design conducted in 5 Malaysian hospitals across Peninsular Malaysia. A total of 155 adolescent psychiatric patients aged between 11 to 19 years old had willingly participated in this study and were sampled through the convenient sampling method. There were a total of 4 instruments along with demographic information to be filled by the participants. The 4 instruments were COVID-PSS-10, which measures perceived stress, GAD-7, that measures anxiety levels, PHQ-9, that measures depression levels, and last but not least, MyMed, which measures adolescents' medical adherence. All instruments, as you can see here, showed good Cronbach alpha value in the study. Now, most of the participants that participated in this study were females. As you can see here, 72.3% of them were females, whereas only 43 participants, which is about 27.7% of them, were males. Results revealed that moderately severe to severe depression levels were seen in a majority of 68 participants. Simultaneously, 28.4% of the participants scored normal to mild depression levels, and another 29% of them scored moderate depression levels. A majority of 75.5% participants in this study had high COVID-19 perceived stress levels, indicating that mental health risks caused by the pandemic. Unlike depression and stress levels where majority participants' scores were on the higher end, anxiety levels of majority participants in this study were seen to score in the minimal to moderate anxiety levels. Out of 155 participants, only a minority of 35 participants were seen to score severe anxiety levels. The significant correlation coefficient obtained between medical adherence and all 3 variables of adolescent psychiatric patient mental health indicated initial support for the study hypothesis. The correlation coefficient did not suggest any problems of multicollinearity, as all correlation coefficients, as you can see here, were less than 0.70. Hence, in view of this result, a multiple regression analysis can be conducted with all three dependent variables. The multiple regression analysis showed that higher medical adherence significantly predicted lower depression symptoms, anxiety symptoms, as well as perceived COVID-19 stress after adjusting for age, gender, and race. The study findings suggest that participants with higher levels of medical adherence do somehow demonstrate better mental health. With that, I would like to conclude my presentation by saying that the findings of this study do highlight the importance of medical adherence as a protective factor on psychiatric adolescent mental health during the COVID-19 pandemic. Therefore, implementing adherence interventions may increase mental health in the treatment of adolescents with psychiatric disorders. That is all for my presentation today. Thank you so much for your interest and attention this afternoon.